Her name was Nataline, 17 years old, blue eyes, walls of her bedroom covered in sketches of dresses she dreamed of designing one day. A girl who loved fashion, who had her whole life mapped out in a notebook. She was diagnosed with leukemia at 14. She fought it. Hard. Her brother gave her his bone marrow the day before Thanksgiving 2007. She was getting better. Then her liver failed. 4 doctors at UCLA Medical Center wrote a letter to her insurance company, Cigna, saying she needed a liver transplant. They said patients in her situation had a 65% chance of survival with the surgery. Cigna said no. The procedure was experimental, they said, outside the scope of coverage. Her family went to the media. 150 nurses and teenagers rallied outside Cigna's office. CNN covered it live. The pressure became impossible to ignore. Cigna reversed their decision. Nataline Sarkisyan died a few hours later. And here is the part that should make you genuinely stop. While her family was burying their 17-year-old daughter, Cigna's executives were collecting their bonuses. The same year Nataline died, the insurance industry posted record profits. 3 words were later found to describe the official strategy of America's largest health insurance companies: deny, depose, defend. Not a villain's catchphrase, not a movie script, a documented, practiced, legally approved business strategy used against people at their most vulnerable every single day. And Nataline's story is not the exception. It is the system working exactly as designed. 5 reasons why, starting with the one that turns your doctor's decision into a business calculation before you ever leave the examination room. Imagine your doctor looks you in the eye and says you need surgery. Not maybe, not eventually. Now, you have insurance, paying every single month without missing once. You did everything right. You planned for exactly this moment. Then a letter arrives. Claim denied. This is not rare. The majority of insured Americans had at least one issue with a denied claim in a single year, according to a 2023 KFF survey. UnitedHealthcare denies roughly 32% of all claims, nearly 1 in 3, before your doctor can do anything. Here is how the machine works. Before certain treatments can proceed, surgery, specialist visits, specific medications, insurance companies require prior authorization. Your doctor cannot simply treat you. They submit a request. Wait. Follow up. Wait again. 30% of radiation oncologists have had a patient admitted to the emergency room or suffer permanent disability because of prior authorization delays. Not inconvenienced, not delayed by weeks. Permanent disability, because an insurance company took too long to approve care a doctor had already determined was necessary. And the people reviewing your doctor's request. 35% of insurance reviewers handling oncology cases are not oncologists. Across all specialties, doctors report reviewers are only qualified 15% of the time. Your cardiologist submits a request. A reviewer with no cardiology training reads it for 7 minutes and decides whether you get the treatment your doctor ordered. Here is what makes this a machine and not just a broken system. Denial rates increased 20% for commercial claims and 56% for Medicare Advantage claims between 2022 and 2023 alone. They are not getting more cautious. They're getting more aggressive, because only 0.1% of denied claims are ever formally appealed. Not because people don't need the care, because appealing is expensive, complicated, and exhausting, and most people cannot fight while they're also sick. Isaac Rosenbloom is 43, a paramedic, father of 4. His insurer refused to approve an MRI for nodules found on his lungs. "Do I have to wait until I start coughing up blood?" he asked. He's still waiting. Drop a comment, denied, if you or someone you love has ever had a medical claim rejected, because the number of people living this quietly, without saying it out loud, is the real data that never makes it into any insurance company's annual report. There is a woman whose husband is in a coma, on a ventilator, unable to speak, unable to sign anything, unable to advocate for himself in any way, and the hospital is trying to discharge him, not because he is better, not because his doctors say he is ready, because his insurance company says his 2 days of coverage are up. She wrote about it after the healthcare story finally broke into public consciousness in late 2024. The stress of being told your coverage is ending, while your husband is in a coma on a ventilator. She eventually signed away his life insurance policy to keep him covered under Medicaid. She lost his life insurance to pay for him to stay alive. This is what the American hospital system has become. Not a place of healing operating outside the economy, a business with investors, with profit margins, with quarterly earnings calls. Over the past 20 years, there have been 1,000 mergers among America's 5,000 hospitals. 3 out of every 4 doctors now works for a corporate group, many owned by private equity firms. And when private equity controls more than 30% of a medical market, prices rise 13 to 18% every time. In every specialty studied, US anesthesia partners achieved market dominance in Denver, then charged rates 30 to 40% higher than competitors. Patients had no choice but to pay. There was nobody else. That is not healthcare. That is a monopoly wearing a stethoscope. The quality of care. A University of Chicago study found private equity ownership of nursing homes led to a 10% rise in short-term mortality. A Harvard study found a 25% increase in hospital complications and 38% increase in bloodstream infections after private equity acquisition. More expensive, more dangerous. At the same time, a woman gave birth prematurely. Her daughter spent weeks in the NICU. The bill, over $80,000. UnitedHealthcare refused to pay because the birth happened at midnight when her coverage had just switched providers. She spent the first 18 months of her child's life receiving hostile collection calls. Her daughter's first year and a half spent fighting a bill for being born. There is a cancer medication called Gleevec, treats chronic myeloid leukemia. It works, doctors prescribe it. Patients survive because of it. In Germany, same pill, same company, same molecules. In America, $90,000 more per year. Not a different version, not an upgraded formula. The same pill, $90,000 more. Because in America, nobody negotiates. Every developed country has a government that sits across the table from pharmaceutical companies and says, this is what we will pay. Companies accept it because market access matters. Prices stay manageable. In the United States, a law called the Medicare Non-Interference Clause literally makes it illegal for the government to negotiate drug prices directly with pharmaceutical companies. Illegal. The most powerful government on earth, representing 44% of all global pharmaceutical sales, legally prohibited from using that power to get a better price for its own citizens. The US spends nearly 50% more on medications per person than the next highest country for the same drugs, bought by people paying the same premiums, working the same jobs, and it gets darker. The same generic prostate cancer medication has over 2,200 different prices across Medicare plans. In northern Michigan, $815. Drive to Lake Michigan, same drug, same dose, $3,400. Not a different medication, not a better hospital, a different zip code. And then there is the question of which medication your doctor prescribes. Since 2014, pharmaceutical companies have paid doctors $12.8 billion in speaking fees, consulting fees, and financial arrangements, up from $6.5 billion when payments first became public. Not all of it illegal, almost all of it a conflict of interest so normalized, so deeply embedded, that nobody even pretends to be surprised anymore. Your doctor may genuinely care about your health above everything else. But if a pharmaceutical company has been paying them $40,000 a year in speaking fees, you will never fully know whether the medication they prescribed was chosen for your body or for their relationship. Subscribe right now, because the final part connects everything, Nataline, the coma patient, the $90,000 pill, into the one question nobody in Washington is brave enough to answer. The United States spends nearly $5 trillion on healthcare every year, 18% of its entire GDP, more than any country on Earth. And in return, America ranks last among 10 high-income countries for health outcomes and access. Last, the most expensive healthcare system in human history, delivering the worst outcomes of any comparable nation on Earth. If this were a restaurant, it would have closed on day one. If this were any other industry, the market would have corrected it decades ago. But healthcare is different. When the product fails, the customer is sick, or dying, or holding the hand of someone they love who is running out of time. And the system, the insurance companies, the private equity hospital groups, the pharmaceutical manufacturers, the lawmakers who wrote the laws protecting all of them, knows this. It has always known this. Arete Tsoukalas was fighting cancer and fighting her insurance company at the same time. In chemotherapy, already the most devastating experience a human body endures, while simultaneously filing appeals, making phone calls, arguing with reviewers who had never met her. No one should have to be fighting cancer and insurance at the same time, she said. People are truly kicked down when they are at their weakest and most vulnerable. She's now in remission. Not everyone gets to say that. Nataline Sarkisyan was 17. Sketches of dresses in a notebook. A 65% survival chance if she got the transplant her doctors requested. Signa said no, then said yes, hours too late. Her mother still holds an annual fashion show in Nataline's memory, still fighting the law that protects insurance companies from being sued for exactly what happened to her daughter. I am a mother. We want the whole world to know her story because Nataline's story will make change. This system did not happen to America. America chose it, through the laws it passed and refused to pass, through the politicians it elected and the industries it allowed to fund them, through decades of accepting that healthcare was a market, and markets reward profit, and profit rewards denial. Every comparable country looked at this model and chose differently. America kept choosing it. The system will not fix itself. Change has only ever come one way, when enough people understood exactly what was happening to them, and refused to accept that it was normal. Nataline's mother wants the whole world to know her daughter's story. Now you know it. Share this with one person who still thinks the American healthcare system basically works. It works perfectly for the people it was designed to protect, and those people are not you. If this channel has been showing you systems for what they actually are, subscribe for the version of yourself that stops accepting broken as normal. See you next week.